everybody, I'm Julieanne.
I'm Carly.
And today we're going to talk about some fluency therapy strategies. We posted a video last week of one of our therapists doing some fluency therapy and had some questions. So to better reply, we decided to do a little video about some strategies for therapy, and there was a question about like what kind of materials or things that we like to use in therapy. So first of all, when doing fluency therapy, it's really like modification strategies. One of the first things we'll do is start by decreasing tension, because when you have a fluency issue, a lot of tension is built up. There's a lot of anxiety behind it. And when your vocal cords are tight, then you're more likely to have a stuttered incident. And so one of the ways that we do that is to do diaphragmatic breathing. And so that's just teaching our kiddos to breathe in through their nose and out through their mouth while using their diaphragm. We may call this belly breathing. We can use different strategies, having them lay on the ground, exhaling and blowing bubbles, teaching them how to exhale slowly. So what this does is it decreases tension, gets them calm, and decreases tension in the vocal fold, because they're inhaling through their nose and breathing out through their mouth. And what that does is you're starting with nice, relaxed vocal folds is what we want to do. Some other strategies for shaping fluency are easy onset. We talked about that.
So speech.
Decreasing your rate of speech when you're talking. We may call this turtle speech. Using strategies like pacing, so tapping to count out and talk a little slower. We may model these types of things in our session, but also talking with parents and teaching them how to utilize the strategies so that they're modeling it appropriately. Because what happens when you're talking really fast or talking really loud, you want to match the person and how the people are talking around you. So if you're coming in and you're talking really loud and really fast, your kid's going to try to match that too. So it's important that you bring that rate of speech down, you talk slow, and you're modeling how you want your kid to speak. We also talked about fluency, social stories, right?
Social stories are amazing. So I think that's what, in the video that we posted, Meredith had actually used that prior to the activity that we posted on Instagram. But social stories are really cool because you can customize them to the individual child. So in grad school, one of my friends, her little girl that was a fluency kid, she loved to dance. So she made a customized story about this ballerina who would sometimes stumble and fall while she was dancing, and kind of related it to fluency. And so it kind of, you can customize the stories and make them more relatable to the kids. So that's what I love about them so much.
Yeah, our therapist Meredith, the one from the video last week, she had gotten hers off a paid teacher, so if you need some ideas of where to start, and then you can kind of modify it to the kid. And social stories are great because it kind of helps kids realize that they're not alone, and can help them process and understand kind of what's going on, so they're not internalizing it. So when they can understand what's going on, then they can, react better and use their strategies more. One of my favorite materials to use is actually from Super Duper, and it's Fluency Flips. It's really great and gives great visuals on easy onset, pacing, and so it starts with vowels and teaching like that gentle onset. And what the gentle onset is instead of going in and like hitting the sound really hard, it helps relax the vocal folds, and you want to start with like nice, open, relaxed vocal folds. And that's going to prevent that stuttered incident, because we talked about it being because of tension, right? So if we're talking about maybe the sentence is apples and oranges, so we're going to start out nice and easy, use our breathing. apples and oranges, and use nice and easy. Another strategy that it helps with is continuous phonation. Keeping that voicing going the whole time, because when you stop the voicing, then you have more of an opportunity for a hard onset or a stuttered incident. So it provides great starting from like syllables all the way up to words, phrases, and sentences, vowel initiation, and then consonant initiation, and then it has great visuals to keep them with that continuous phonation. I really love the Fluency Flips. And Super Duper also has great handouts. I don't know if you've ever used them for like parents and stuff. So you can go on and like there's lots of information about what is a fluency disorder, what are fluency shaping, and things that you can do at home. So if you're a therapist, checking out Super Duper for their handouts, and then like we said, Teacher Pay Teachers has so many great resources, and that's what Meredith was actually using. Had that printout that it had listed the different strategies, and she had already reviewed them with her kiddo previously, and so this session she's like, okay, now let's talk about the strategies that we're using. And she went through, and he was able to say all of the strategies that he needed to do to really implement those.
And I really like little visuals. Visuals are awesome, and I like, especially for the little ones with fluency, that it's harder to explain to them because they're so little. We would use a little stuffed turtle when you're doing turtle talk, and so you can have the little turtle while you're playing, and if they kind of start talking super fast, you can say, oh, don't forget your turtle talk, and you have the actual turtle. Or sloths, because sloths are really in right now, and sloths are really slow too. So having those actual things that they can see and touch to relate to what you're trying to teach them is really helpful too. I find.
Yeah, and then it's a visual reminder, so you don't necessarily even have to say anything. You just kind of pet it or pick it up and be like, let's not forget about this little strategy over here. But so that is our little tidbit on fluency and fluency therapy. So if you have any other questions and things that we post, please let us know, and we'll try to hit you up with some more videos and knowledge that hopefully will help you out.
For sure.
Yeah, thanks for watching.
Bye.